So the facts, are you hearing more about dementia? I bet you are. As far as Alzheimer's disease, the most common type, 1 out of 8 people 65 and older have Alzheimer's disease. The scary news is, starting on January 1st, 2011, up to 10,000 baby boomers a day turn 65, and that happens every single day for the next 20 years, every single day. So explosion. When we get to age 85, 47% of people have Alzheimer's disease, according to the latest statistics. What's the fastest growing segment of human population worldwide in developing and developed countries? 85 and older. So we don't have any medications to reverse the progression, to cure it, to prevent it, so we've got to equip ourselves with how do we offer these individuals the same excellent care we offer people with other more common illnesses like cancer, etc. Alzheimer's disease is a terminal disease. However, usually the most common cause of immediate death in dementia is aspiration pneumonia. So remember, as the disease is moving through the brain, progressive neurodegenerative changes, ultimately it will affect swallowing. Swallowing is a very complex coordination of things going on. And so the person, you might hear them choking, or even in their sleep, they might have silent aspirations. Just some saliva goes down into their airway due to decreased mobility, decreased nutritional intake. Their immune systems aren't robust like they used to be, so a person can be set up for pneumonia. The great news is it's a very comfortable way to die when you know how to treat all of the symptoms. So there's many different types of dementia. Don't know what you're used to seeing. Of course, you're going to see a lot of Alzheimer's disease. You're also going to see quite a bit of Lewy body dementia. Maybe some Parkinson's disease folks have progressed onto Parkinson's disease dementia. As you know, people with cardiovascular disease can also wind up getting like a cerebrovascular, a vascular dementia. And then we have some of the rarer ones, like the frontotemporal dementias, probably the most commonly known as Pick's disease. As the dust settles, because you're getting so much information, but someday I want you to get the book that we have called Joining the Journey, A Guide to Dementia Comfort Care. Joining the Journey, that phrase was particularly chosen because that's our philosophy. Those of us who went to nursing school many years ago were taught whenever you have a confused patient, you always bring them back to reality, don't you? But we know with dementia that the person, if they think today's Christmas, now we know better to go, Merry Christmas. You want to sing Jingle Bells? Jingle bells, jingle, because it's more to uphold their dignity and to help them be right in a world where frequently the world is going wrong. And so 5 minutes from now, it might be a different place anyway. So the philosophy is to join the journey, go with whatever they're saying. And sometimes, you know, that's difficult to practice at first, but we want to support you in that process. And as you develop it and expand upon it, don't hesitate to call us. In the Joining the Journey is this book. The changes in this brain are based on the Alzheimer's model. But just very, very quickly, what I wanted to point out is these areas in here, there's an area in the brain called the hippocampus, so we have one on both sides. The hippocampus is what takes in new information, brand new. Like if I say, I'm going to tell you 3 words, table, apple, penny, repeat them after me. Table, apple, penny. And hold on to those words because I'm going to ask you them in about 2 minutes. Okay. Your hippocampus takes that in and it kind of encodes it or puts it somewhere where you can reach for it later. Look at the hippocampal regions in advanced dementia. It's pretty devastating, isn't it? So therefore, when I hear staff saying to patients, you don't listen very well, you don't pay attention very well, it's so painful because the cells aren't even there to take in and encode the information. That's why it's of that amnestic property. Also, okay, think about, here's the front part of the brain, and we think that Alzheimer's disease begins in this temporal area here. But as you can see in advanced dementia, if you could see this a little bit better, there's blue-gray areas everywhere, really talking about the progressive neurodegenerative changes that are occurring. And as they're occurring, the individual is becoming more and more vulnerable and dependent on us to get every one of their needs met.